Adult compressions and hands-only CPR. An adult in the context of CPR emergencies refers to individuals who have undergone or completed puberty. Steps for administering chest compressions. Position yourself beside the victim. Ensure the victim is lying on their back on a stable, level surface. If the victim is unconscious and face down, turn them face up while supporting the head, neck, and back. Promptly remove any clothing obstructing the chest area. Adopt the appropriate hand placement for chest compressions. Position the heel of your hand on the breastbone, situated between the nipples. Place the other hand on top the first hand, interlocking the fingers. Keep the fingers clear of the chest. Assume the correct body posture for CPR. Kneel down, maintain straight arms positioned over the chest, and align your shoulders above your hands. Ensure your elbows are locked. Administer 30 forceful and rapid compressions, pushing at least 2 inches, but no more than 2.4 inches deep, maintaining a rate of at least 100 to 120 compressions per minute. Chest recoil. Ensure the chest rises fully after each compression. Do not lean on the victim's chest after each compression cycle. Hands-only CPR cycle. Hands-only CPR is an essential life-saving technique that can be performed by bystanders when someone suddenly collapses and is unresponsive, particularly in cases of sudden cardiac arrest. This method focuses on delivering high-quality chest compressions without rescue breaths, making it easier for untrained individuals to provide immediate assistance. To perform hands-only CPR, place the heel of one hand on the center of the victim's chest, place the other hand on top, and interlock your fingers. Hands-only CPR is crucial in the first few minutes following cardiac arrest, as it maintains blood flow to vital organs until professional medical help arrives, significantly increasing the victim's chances of survival. Who's it for? Any adult who collapses, stops breathing, and is unresponsive. Mouth-to-mouth breaths are still necessary for children, infants, and drowning victims. What to do? First, call 911 or ask a bystander to do so. Then, press hard and fast, approximately 100 to 120 times per minute, at the lower portion of the victim's chest. Continue until EMS arrives, an AED becomes available, or you are too tired to continue. 2. Rescuer technique. Utilized 2 rescuer technique when a second rescuer is available for assistance. Allow the second rescuer to activate the emergency response system, dial 911, and retrieve the AED. The first rescuer should remain with the victim, prepare to remove clothing from the chest and initiate CPR. When both rescuers are present with the victim, they should alternate performing 30 chest compressions, switching approximately every 2 minutes. Rescuers should remind each other to push down at least 2 inches, but no more than 2.4 inches deep, and monitor for proper chest recoil.